Hospital beds in the NHS have never been under more pressure.
It's just unrelenting at the moment.
With more patients to care for than ever before, and only 150,000 beds to go round.
It is a fast-paced job. There's a non-stop conveyor belt.
In this series, we use special cameras on beds in 4 very different hospitals.
Comfy bed.
To see the world through the bed's eyes.
Left at the lights.
As they share the most challenging.
Oh, it's coming again. Oh. Please don't get upset. I will look after you, okay? Are you okay, Pet?
Most intimate.
Nah, it's good.
And most rewarding moments of our lives.
You get in hospital and you go,
Coming up, in Barnsley, on Resus Bed 2, 56-year-old Elaine's life is on the line as she struggles for breath.
Don't be scared. We know what we're doing, okay?
In Leeds, on paediatric Bed 3, 5-year-old Edward reaches the finish line in his treatment for leukemia.
How long's your journey been going on for?
Like 3.5 years. Yeah.
And in Leicester, on maternity Bed 5, first-time mum-to-be Marcel faces the reality of giving birth.
I'm so ready to meet him, but I'm not ready for the pain to meet him. I'm scared.
Bed's like an extra member of staff almost.
This is the secret life of the hospital bed. Barnsley Hospital in South Yorkshire.
Hello, Emergency Department, Barnsley. What are his numbers?
Its A&E department has 5 resus beds that see around 4,000 critically ill patients a year.
43 patients in the department at the moment.
Anyone briefing the DDT nurse?
So it's just a constant cycle, really.
These beds are reserved for patients whose lives are at risk.
Okay, bit of pushing.
She's in, yeah, she's in cubicle number 3.
Today, Resus Bed 2 is being prepped for its next patient. 56-year-old Elaine has been rushed into hospital gasping for breath. She's suffocating and barely able to speak.
Don't be scared. We know what we're doing, okay? So please don't get upset. I will look after you, okay? All right?
Elaine has a tube in her neck to allow her to breathe, but it's become blocked.
Are you allergic to anything? Penicillin and doxycycline.
Dr. Cliff has to act quickly to clear the airway.
Good, well done. Just nice deep breath. You're going to get you some more saline for this as well. It's an acute emergency. She's essentially drowning. It's essentially like somebody taping your mouth shut. You've got seconds to react.
Elaine's tube is removed and flushed out with a saline nebulizer.
Got some suction.
Are you ready for suctioning again, sweetheart?
At Elaine's side is soon-to-be daughter-in-law, Gemma.
The tube is like blocked. She can't unblock it herself. It's awful. It's awful when she can't breathe. Yeah, very scary.
How old are you, sweetheart? 56.
Elaine had to have a breathing pipe inserted 5 years ago due to having chronic lung disease. She's been rushed into hospital with a blocked tube several times.
Elaine has had what we call a tracheostomy, so it's a tube that helps her breathe through her neck rather than through her mouth. When you've got that artificial airway, it's got the potential for it to block off.
Is that feeling any easier? Yeah, starting to work. Yeah.
After 20 minutes, Elaine's symptoms have calmed down, but she's not safe yet. Dr. Cliff has seen this happen before.
Because you scared me on my first day of ENT, didn't you?
Monty never forgotten.
I've got to scare you at least once.
Well, yeah, she scares everybody. Luckily with Elaine, she knows what to do in the majority of the time, but as panic sets in, you don't always think quite rationally, and at times when she is unwell, then she needs to come into hospital for extra support.
It's lovely not sometimes.
My hero. He saved me more than once. I scared him to death first day with you. Because I go blue when I can't get no air in. I go Smurfettes. And that's what they nicknamed me, Smurfettes here. But he's a really good doctor, really nice doctor.
But at least we can smile about it as well afterwards. It's an unfortunate situation with Elaine, but she's a lovely lady who makes the most of it as best she can. She's always got a smile on her face and always happy, so it's always nice to see her.
Do you feel like you still need suctioning? Yeah, brilliant. Bless you, I'm so glad you're here. Thank you.
Doctors need to monitor Elaine in case she starts to suffocate again.
They'll even decide to keep me or let them go. I'm hoping they're going to let me go.
We'll return to Resus Bed 2 later to see whether Elaine's condition stabilises. Leeds Children's Hospital is one of the largest paediatric centres in the UK. It has 26 beds on its day surgery unit.
I dance a lot.
These beds are with their young patients through tough times, both before.
What do you like to do when you're in hospital?
Go home.
And after surgery. Paediatric Bed 3 is ready for its next patient.
Yeah.
This is number 3.
Wow.
This is your bed for the day.
That's good, isn't it?
Perfect, right, make yourself comfortable.
The first patient to arrive on the ward today is 5-year-old Edward. He's here with his mum, Steph.
Smelly feet.
Edward has come for an operation, which will mark the end of his treatment for leukemia.
Do it.
Oh no! It's okay, Edward, we can fix this.
For the last 3.5 years, Edward's treatments have been administered via a port line in his chest,
He's quite proud of it, so he's not scared of showing you.
which is often referred to as a wiggly.
So why have you come with us today?
Take my wiggly out.
Have you? So have you got a wiggly? Are we gonna? Do you not need it anymore? Are you excited?
No.
No. Have you got? Sometimes you get attached to these things, don't you?
Looking after Edward today is Sister Nuttall.
You wanted it out, but he did say, oh, why does it have to be today?
Oh dear. Did you have something better to do?
Clearly. And I've just said, oh, she said you can't go to school tomorrow, and he's like, oh, for God's sake. It's such an inconvenience.
That's good, isn't it?
Yeah.
How long's your journey been going on for?
Like 3.5 years.
Oh, really?
Yeah.
So this is like a complete milestone, isn't it?
Yeah, God.
Edward was diagnosed with leukemia 3 years ago, when he was just 2 years old.
I remember it well, but it was one of those things like, you just think, fine, what do we do? So it wasn't the end of the world for us. They said the odds are good for children to recover from it. It's just a long journey.
Survival rates for children with leukemia have improved dramatically in recent years. 90% of children diagnosed survive more than 5 years, after which a relapse is considered highly unlikely.
That's a rude noise.
Can you do it?
What? I can't do it.
It's a song.
Surgical registrar Ms. Anna will be performing the operation today.
All right, Edward, today's the day. Do you know what we're going to do today?
What are you here for?
Taking the wiggly out.
We're taking your wiggly out. That is very true. We used to be able to give it to you to keep.
I don't know.
If you wanted. I'm afraid we can't anymore.
Well, I don't know what we'd do with it.
But would you
anyways.
like a photograph?
Would you like a picture of your wiggly?
Yeah.
Are you happy?
Yeah.
So he's been under treatment now for about 3-4 years. And it is serious. It was a type of blood cancer. But his prognosis is very good. And the longer it goes on, the more likely a positive outcome.
Oh, no, you won. Look, you won.
Where?
There, look.
Yay!
You didn't even know. I shouldn't have told you.
Edward is finally called to surgery, leaving paediatric bed 3 behind as he heads to theatre.
Oh, you're so heavy.
Later, we'll rejoin Edward to find out if his port line is successfully removed.
Hello.
Leicester, at the Royal Infirmary's maternity unit. More than 100 babies are born here each week.
Oh, my word.
Fantastic, congratulations.
The unit's 16 beds are constantly under pressure, working a 24-hour shift.
Come on, you can do this. You're doing absolutely amazing.
7 days a week.
The bed situation, it seems a lot better today. Busy days can be a bit manic. That's part of the job, isn't it?
There you go. I think you were busy.
Maternity bed 5 is ready for its next expectant mum.
Bless you. What I'll do is I'll get you some pain relief and some digocodeine here as well. Okay. That's it. You'll be all right in a minute.
First-time mum-to-be, 25-year-old Marcel, has been admitted to the unit today, 2 weeks ahead of her due date.
Let's take some nice deep breaths, okay? That's it. All the way.
She's in the early stages of labour, and there are concerns.
Well done. Can I turn you on your left side for a little bit? Is that all right? I'm just going to lay the bed back a little bit, just to wake baby up a tad. Yeah?
Midwife Struck is checking the baby's heart rate and movements.
Is it meant to hurt more if I go on this side?
No, sometimes it might, just as the baby's positioning, but it's just to try and wake baby up a little bit, that's all. The baby's a little bit what we call sleepy, so turn Marcel onto her left side on the bed, and the idea is it increases the blood flow and therefore, you know, improves baby's heart rate, and that's what we always do.
Marcel's baby is moving less than normal, a sign that the baby's health may be at risk.
Yeah, because we're going to be on here for about half an hour with your contractions, and they're starting off perfectly. This is how it all begins. I just want them to last for a little bit longer. Yeah, real toe curler ones. Okay. So we're going to be on here for about half an hour. All right, baby looks quite happy at the moment. All right. Okay.
Marcel's mum Margaret and her auntie Susanna live nearby. They're on their way in to support her.
My mum's name's Margaret. We're practically best friends. We do everything together. She knows me like no one knows me. I don't know what, I would probably don't know what I'm doing for this whole pregnancy without her. Yeah, she helps a lot. Hello, girl. Hello, my dad. Ready? I'm not ready. Still not ready? No. My back is killing me. Careful with the camera.
Marcel desperately wants to have a natural delivery. Only around 1 in 4 women give birth in the UK without any intervention, such as an induction or an epidural.
It breaks my heart to know that I can't take away the pains from her, but she knows that I'm here. This is just the beginning of, let's say 1 to 10, she's about 2. Yeah, 2. So I'm just preparing her for the other 8 steps to come in terms of the shoulder pain.
It's kind of like I'm so ready to meet him, but I'm not ready for the pain to meet him. Does that make sense? I'm like, I just wish he could just appear out of nowhere. Is there no way around it? There has to be a way around it. I'm scared.
We'll return later to maternity bed 5 to find out if Marcel manages to have her dream natural birth. Back at Leeds Children's Hospital, on surgical bed 6 is 5-year-old Edward, who is in remission from leukemia. He's having an operation to remove the port line through which his medications have been given, marking the end of his cancer treatment. Surgical registrar Ms. Anna will be removing what is known as a wiggly or port line.
So once the patient's asleep, we'll cut through the tissues and we'll find the port and then we'll remove it. so he can take a photograph, Mr. Wiggly. Yeah, it's like the happy ending to the story in a way that you get to at the end.
Edward's mum, Steph, has to wait outside theatre.
You know, they're gonna be okay, but it's still worrying because I don't know how long I'm waiting. It just makes it. So I'm just sat here hoping that it's gonna be okay.
It seems okay at the moment. I'm just releasing the port. We got retractors. Okay, so we're about to remove the port now. So this is the line that was sitting in the vein. And there you go. There's Mr. Wiggly.
The port line is successfully removed. For Mum Steph, this means the end of constant hospital visits.
I can't even express how happy I am about it. That was the final thing that needed to be done, so like from today, that's it, we're done.
After 45 minutes, Edward's operation is over. Surgical bed 6 takes him back to paediatric bed 3 on the ward.
Ready, steady, move.
Within an hour, Edward's awake, and he soon notices that something has changed.
No wiggly?
I can feel it.
You can't feel it? Look. That's what we're in there, so that bit there is where they put the needle in, and all your medicine went into there, and that is what went up there.
With Edward's treatment over, his family can now plan for the future.
We need a holiday, don't we, Edward? Yeah, we've not been able to go on a proper holiday for years, so yeah, we can't wait to be able to go. And Edward wants to go on an aeroplane, so we have to go on an aeroplane, don't we?
The time has come for Sister Nuttall to discharge Edward from paediatric bed 3.
Well, it's been lovely to meet you.
Yeah, you too.
Good luck with everything else.
Thank you.
And hopefully, young man, we won't need to see you again, will we?
Took my wiggly out.
Because you took your wiggly out,
Yeah, your wiggly's all gone, so you don't need to come back and see us. That's really good, isn't it? Yeah?
Yeah.
Okay. It's absolutely fantastic, just being in the system for 3 years, having treatment. He's had a lovely recovery, he's done really, really well. So yeah, I wish them both the very best for the future, get on with their lives.
Bye-bye.
Thank you very much.
Thank you. See you later.
As Edward and his mum head home, paediatric bed 3 is free to be stripped down, ready for its next patient. Coming up on The Secret Life of the Hospital Bed.
You know you're safe though, don't you?
On Resus bed 2, Elaine's breathing tube blocks up again, leaving her gasping for breath.
This might change plans about going home. You know that.
In Leicester, on maternity bed 5, there are complications with Marcel's labour.
Still got a pain there.
And in Leeds, on paediatric bed 3, 2-year-old Isaac faces surgery.
I know I've got a real phobia, and I know that I'd been absolutely no good and I'd make him worse.
Back in Barnsley's A&E department.
She's got a new AF. She's got a couple of rib fractures on the X-ray.
Resus bed 2 is with 56-year-old Elaine.
Don't be scared. We know what we're doing, okay?
Elaine was rushed into hospital when her breathing tube became blocked and she started to suffocate.
Good, well done. Just nice deep breath. You're gonna get you some more saline for this.
After emergency intervention by doctors, her breathing has begun to stabilise.
How's that feeling? All right, better. I bet you're shattered, aren't you? Yeah.
You can't breathe in, you can't breathe out. It's like you're choking on horrible stuff. And it's really scary.
Like Elaine, around 12,000 people have a tracheostomy tube inserted each year to enable them to breathe.
I can't even play with grandkids because I get so breathless. I'm only 56, I should be able to play with my grandkids.
Elaine has been told she will need to have the breathing tube for the rest of her life.
I think my sense of humour gets me through. I used to be a blue comedian and a singer before this happened. So I think that sees me through a lot. Having a sense of humour.
Elaine's been on resus bed 2 for an hour and a half. Dr. Cliff comes back to check if Elaine's breathing has improved.
So when are you next due for a trachea change?
It's due next week.
Okay, fine. So you've got follow-up with...
ENT.
Yeah. Right, and you've got spare tubes and things at home with you?
I have.
Yeah, good. Do you feel well enough to go home?
Yeah.
Yeah?
I feel a lot better now. You just panic, don't you, when you can't breathe. There's no worse. I can go home. Yes. I can go home. So that's...
Cleaned and back up.
You need suctioning.
10 minutes later, Elaine's condition takes a turn for the worse.
Just hold that there for me, Pat. Let me just grab some gloves.
Nurse Reynolds has been looking after Elaine for several hours.
This might change plans about going home. You know that. But the bottom line is we need you to be safe.
There's no point going home if I come back.
No.
And if this happens during the night and we're asleep...
Yeah, that would be another story. I'm going to go and speak to the doctor. Just give me 1 minute, okay? Are you alright holding it there? I'll be back in a sec.
You keep saying sorry, it's not your fault, is it?
I've given her a saline nab and suctioned. But this might change the plan about going home.
How are you feeling now?
Feeling a bit better, but still rubbish.
Right, should we take that energy out again? Have a look. So Elaine's had another episode where she's blocked up her trachea again. Those secretions are just too thick for her to be able to get up, and it's blocking off in her neck. So we're having to keep her back on the nebulizers, but we're probably going to have to do it as an inpatient setting because it's happening too frequently for us to let her to go home.
No point sending you home if you're not well enough, darling, okay? Your oxygen levels are good, they're 99, okay, and yeah, that's really good.
Elaine's hopes of being discharged have been dashed. She'll stay on resus bed 2 until her bed becomes free on another ward. Back in Leicester, at the Royal Infirmary, maternity bed 5 is on the move to the high-risk delivery unit.
Yeah, come with this.
Yeah.
25-year-old mum-to-be Marcel had been hoping to have a completely natural birth.
Oh, we're nearly there now. It's just one of these rooms on the right-hand side.
Oh my God.
But midwives fear her unborn baby may be at risk, so they want to induce her using a hormone drip.
I'm not too happy about obviously having to have the drip, the hormone drip, but I rather that than having to have the complications of delaying labour and then having to have forceps or C-section. So it's kind of like the best of two evils.
Midwife Tattersall has taken over Marcel's care.
Everybody's different. Some people respond to it really quickly, some people it takes a little bit of time to get them into labour. So just so you're aware, you know, on the most part it's very effective. All right, but
initially she started off essentially as a low-risk lady, but because she's had the episodes of reduced fetal movements and now we're going to be starting her labour, it then puts her in a higher risk category.
Marcel is being supported by Mum Margaret and Auntie Susanna. Marcel's had to let go of her dream of a completely natural birth, but she's adjusting to the situation.
Some people actually break down because their mind is so set that that is the birth that they're going to have, that they can't comprehend something else, and then they stress the baby and then end up having to have forceps and C-sections because their mind isn't ready to adjust to a change from their birthing plan.
After 15 hours on maternity bed 5, Marcel eventually reaches the final stages of labour.
Now listen, Marcel, you're fully dilated. Yeah. Your baby's head is just sitting here. you've got next to no work to do at all. She is fully dilated, so we're going to give Marcel an hour, which means because she's got an epidural that's working on board and she's comfortable, the contractions will do some of the work for her. So when we start pushing, she'll have less work to do. I'm excited. I'm really pleased for her. So hopefully we'll see her baby soon. Still got a pain there? Okay, really go for it then. Big push down for me. Good. Good, that is perfect. Well done. Now keep that coming as long and hard as you can. And again. Good, good. Well done. You're doing brilliantly. Won't be long before we get to see him. Give baby some space. That's it. Fantastic. Now keep that push coming. As long as you can. Big deep. Okay, that's your baby's head delivered. Okay, that's the worst part. You've done so well. Next contraction. Big push down into your bum and we'll have your baby, okay? Okay, so that's how the anterior shoulder delivers. There we go. Fantastic, congratulations. Oh, congratulations. She's lovely. Like a little brat.
Thank you so much. Absolutely. Over the moon, there is no words to express how joyful I am to be a grandma. And going to be a proud grandmother. Absolutely.
Marcel, you did it really lovely. You're a star.
Oh, Marcel, he's lovely. He's beautiful.
Hello.
Maternity bed 5 will stay with Marcel and baby Dylan while they share precious bonding time together. Back in Barnsley's A&E department.
To go down to 29, that would then give a bed for the lady in A&E.
On bed 12, 72-year-old David has been rushed in by ambulance, having fallen 6 feet from a ladder.
Ooh, that's painful.
He's with his wife for 50 years, Di. David has been given morphine. There's concern he may have fractured his spine.
How did he get up off the floor?
I don't know. That took a bit of doing. I had to stay there a second.
Well, you got your wind back.
Hello.
Hello.
Consultant Dr. Walker is treating David today.
Right. What brings you to us today?
Came off a ladder.
So your feet were about that high?
Yes.
Okay.
All at once, the ladder slipped. And,
so the ladder went like that, did it?
That's
down?
Correct. Landed on my back.
So is the main problem your back?
The back, yes.
You had a fight with the concrete floor?
Yes. From 6 feet.
You've got to mend it now.
Do you want to show me where the most painful bit is? Round here. Can we get your dressing gown off?
We can.
You got your pyjamas on underneath, have you?
I hope so.
So where's it sore?
About there.
Okay.
Just on the back.
So any pain further up here?
No.
Just rest yourself back. Right. Okay. So we probably need to get an X-ray of your back.
Right.
Okay, of your lower back.
Fine, yes.
And then we'll see what we can find.
Right.
You'll go to X-ray and I'll see you when you come back.
Lovely.
Okay?
Thanks very much.
All right.
Ladders account for around 40% of falls from height, causing major injuries. Dr. Walker believes David's fall may have caused serious damage.
He is 72, so he's not a young man to be climbing a ladder and falling off it. Older people get quite severe injuries as a consequence of just falling from standing, never mind falling from 6 feet.
He was determined. He was coming home after he'd had this accident. He wasn't going to, you know, stay about at the bottom of the ladder and call for an ambulance. It's just not him.
I was in agony, but I didn't. After I'd had a rest, I thought I'd be all right.
Tough Yorkshireman, you see.
I don't know about that bit. I managed to get in the bath, you know, to relax. And then I couldn't get out of the bath.
Then I started shaking, so that's when we spoke to the paramedics.
I mean, a lot of people are very stoical and they will not want to bother anybody. And there's a balance between rushing up to hospital when you're slightly unwell and being too stoical and waiting too long, such that your delay actually adds problems to your management.
When you've had that morphine, you feel a bit dopey.
You don't look as good now. He's had 2 knee operations, bless him, and various other operations too. So he's my bionic man, I think.
If David's spine is fractured, it could have a serious impact on his life. It could also ruin his birthday celebration.
Oh, it's going to be his birthday next Monday. We booked a secret party, got a cake, having champagne, like you do. But, now what? Yeah. Dun, dun, dun. Watch this space. That's,
right,
he caught us in the act.
It's time for A&E bed 12 to take David to X-ray. We'll return later to find out if he has fractured his spine. At Leeds Children's Hospital, the day surgery unit's 26 beds meet children having a range of different procedures. Many involve putting the child to sleep.
You asleep soon, honey bun? You're a good boy, then.
You're a good boy. You see him, baby?
Bunny, aren't you?
Okay, baby. See him, baby?
That's great. Thank you very much.
Good boy.
Usually, the children take it all in their stride. But for parents, it can be a struggle.
It's very emotional to see the child go to sleep, and I don't think a lot of parents realise what happens until they're actually in that situation.
Paediatric bed 3 is being prepped for its next patient. 2-year-old Isaac has come in for an operation on his groin.
It's Mr. Turbo. Oh, do you want this one? You're going to have some more toys. Hey, where are we?
With him are parents Pete and Lorraine.
We've just come into the hospital today for a minor operation, really, for Isaac. It's just something that's quite common in little boys.
Wants to be touchscreen there, doesn't he?
Oh, it's touchscreen.
No, touchscreen, no good. Huh?
Yay! Good boy. Yay! I've been getting sort of really flustered and really in a state as much about the operation as in being put to sleep, really. And I think it's that's been worrying me. So it is as though it's massive, but I have to keep saying it is not. It is a small operation, but yeah, still really worrying.
In charge of putting Isaac to sleep today is anaesthetist Dr. Johnson.
Hello there, you're right.
Yeah.
Keep Isaac occupied.
Hi.
Hiya there.
I'm one of the anaesthetic consultants.
Hello.
So I'm going to be putting Isaac to sleep today. Now
This is the bit that I've been really well and we're all a bit about this bit, yeah.
Now he's got Down syndrome, is that right?
That's right.
How does that affect him? Is there any problems with his general health?
He doesn't have any problems, he's fine.
So he never has any episodes where he gets blue or particularly short of breath or collapses or anything like that?
No.
Good.
You do worry because he's in someone else's care, and just the whole thought of it, and then having to be put to sleep, the needles are not very nice. And I don't know if that's my own phobia of things. So all of that I'm not really wanting from him. But he needs to sort of put my mind at rest. He's going to be sort of put out with a mask and not know about the needle too much, I hope. And will one of us be able to be in with him when you put him to sleep, and they'll be in?
Yeah, so you can come down.
But Dad will there. I'm not
I
very
think
good
we'll
with
just
needles.
have a big cuddle on your knee. And,
yeah.
pop the mask on.
That's lovely. Right, that's great. Thank you
No
very
worries.
much. Oh, that's
Good.
okay.
We'll see you later, Isaac.
See you later.
Okay.
Bye-bye.
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 So parents give us their child to look after. It's a real privilege, but it's also a big responsibility when I actually think about it. Often because it's routine and you do it day by day, you don't really think about the impact every time, but occasionally it does hit home. You are suddenly responsible for this very precious person.
Down syndrome occurs in around 1 in every 800 births. It's a genetic condition that results from having an extra chromosome.
During my pregnancy, it was a bit of it was a massive shock. I didn't know anything about Down syndrome. but it started us on a really positive journey, really. It isn't an illness, he's just a person. He's just a type of person, a fantastic person. You want that one?
With surgery busy today, Isaac and his parents may be in for a long wait.
I'm getting a bit more nervous now because the waiting, I think. I don't want him to have this done, but I know he's got to have this done because it's what's best for him, so I'm trying to be calm.
Later, we'll rejoin paediatric bed 3 as Isaac is finally taken to theatre for his operation. In Barnsley, A&E bed 12 is taking 72-year-old David for an X-ray on his spine.
I am. Well, I was when I set off.
There's concern it may have been fractured when David fell 6 feet from a ladder.
How have you fallen?
Off a ladder onto a concrete floor.
Right, David, breathe in. Hold your breath there. And breathe normally. That's it. Looks like we're done.
Is that it?
Yeah.
Oh, very good.
Back in the busy A&E department, bed space is in such demand that David and his wife Di have lost their place.
I'll turn that off, yeah?
Oh, I think we're waiting for a cubicle now. We moved out, somebody moved in. So.
I'm going to put you into 5 now.
Oh.
Consultant Dr. Walker is back with the results.
Right, where are we going? At last.
Oh, well, yes.
Have you got the results?
Yes, there's nothing broken.
Fine.
Yeah, your spine's fine.
Oh,
yeah, just bruised your back. So it will be sore for a few days. Yeah, it will be. It will.
Yeah,
so,
right.
David has plans to celebrate his 73rd birthday in less than a week's time. With the X-ray showing no signs of a fracture, the couple are hoping he'll have recovered in time.
I'm feeling a bit better now. So it might be all systems go with a bit of luck. Yes, well, hopefully we'll be able to go to the party. I might be driving, and that's bad news. I get told off when I drive.
But they put me on antibiotics, no doubt, so I shan't be able to have a glass, shall I?
he needs to rest at times, but also keep mobile, keep walking around.
David can now say goodbye to A&E Bed 12 and make preparations for his birthday celebration. A&E Bed 12 is cleaned and ready for its next patient. At Leeds Children's Hospital, 2-year-old Isaac has turned paediatric bed 3 into his own play area.
This one going for walkies. Don't you going for walkies?
He and parents Pete and Lorraine have been waiting for several hours to be called for surgery.
I think the majority went down now, sorry.
Oh, is he next? Oh, fantastic. Oh, more anxious now. All right, thank you. Sorry, not long. Thank you. Oh, Isaac.
It's now finally time for Isaac to leave paediatric bed 3 behind as he heads to theatre and the operating table for surgery to his groin.
Come on, me kiss then. Give us another. Hey.
You're okay. Be all right. They're going to put him to sleep first, aren't they? Come on. Awful. More because I know I've got a real phobia and I know that I'd been absolutely no good and I'd make him worse. I feel like I let him down because I wouldn't be much good. And that caused more catastrophe than anything else.
Well done.
You
have to give him a quick kiss. Okay, we should look after it for you.
We'll take good care of him from now for you then.
Thank you.
Whilst Isaac is prepared for surgery, Mum Lorraine waits on the ward.
You know, when I had Isaac, now I say, oh, Isaac has Down syndrome, and it just rolls off my tongue, and it's not. I never think, oh, it's Down syndrome. You know. But since we've had him, I and my husband have learnt a lot about ourselves. The one thing I regret about my pregnancy was ever crying when we knew we thought it was the end of the world. And I'll look at Isaac sometimes and I'll talk to him and I'll hold him and I'll say, I'm so proud to be your mum and I love you so much. And I want to say I'm sorry for ever crying about, for ever shedding a tear, because there was no need, no need, no.
Consultant surgeon Mr. Crabb begins Isaac's surgery.
So I'm putting local anaesthetic into the wound. So although Isaac's asleep, I want the wound to be numb when he wakes up. 2 pairs of 2 forceps, please. And just bring that one just inside the...
Back on the ward, Pete and Lorraine count the minutes.
Oh dear, come on. Oh, I hope he's all right, but there's not any... When it's taken a while, you think, oh, is there any complications or anything? Is everything going to be all right? What time is it now? 1:45. It's taken a long time, isn't it?
Really?
After an hour, Isaac's surgery is complete, and as he begins to wake, he can finally be reunited with his parents.
Oh, hello there. Oh, no. Oh, hello, my gorgeous. Oh, darling. Have you been soft? Oh, thank you. I didn't expect you being up. I thought you'd be out for it, Isaac, to be honest. Thank goodness, thank you. Oh.
Isaac can now return to paediatric bed 3 to rest and recover.
Yeah, it's a relief to have it over and done with now. We were apprehensive when we were down there, but when we went in and the doctor said that everything was fine. So I'm just glad that he's out of it now. Bit grumpy, but we're on the upside now.
He's enjoying his toast, so it's a good sign, isn't it?
Hey, more with it. About up there. Yes. Yay!
With Isaac rested, fed and watered, the family are given the all clear to head home.
Thank you very much. Thank you. Bye-bye. Bye.
Paediatric bed 3 can now be cleaned and prepped for its next patient. Our hospital beds have given us intimate access to the work of the NHS. Elaine was kept in hospital for a week. After being discharged, she moved in with her son and daughter-in-law. Edward is doing well and not missing his Wiggly. The family are trying to book a holiday. Yay! And Marcel is enjoying special time at home with baby Dylan. She's getting plenty of help from Mum. The beds are now back on their wards, ready and waiting for their next round of patients.